Norovirus is one of the most common causes of foodborne outbreaks and illness in the United States. In 2017, norovirus was responsible for 35% of confirmed foodborne outbreaks and 44% of illnesses associated with foodborne outbreaks. Due to norovirus's extremely contagious nature, the difference between a case of food poisoning and an outbreak is often determined by setting. Common locations of outbreaks include healthcare facilities, schools, and vacation spots like cruise ships and resorts. These locations feature close quarters, which is ideal for person-to-person spread. The first step in containing and eliminating norovirus outbreaks is actually detecting them in the first place. There exists across the world robust networks and surveillance systems for the detection of norovirus outbreaks, using passive and active methods. The most effective methods of classifying norovirus cases for report to the appropriate authority are molecular, such as sandwich-type immunoassays and polymerase chain reactions. The CDC assists localities by performing these tests as needed to keep up with an appropriate throughput. Ideally, norovirus outbreaks would be prevented before they can even occur. Locations at high risk for starting and spreading outbreaks, such as schools, hospitals, and restaurants, are the subjects of strict regulations and public health campaigns, aimed at reducing the chance of an outbreak in the first place. Unfortunately, due to the difficulties associated with cultivating norovirus, little empirical evidence exists regarding the most targeted methods for preventing the spread of norovirus. Thus, a shotgun approach is employed. Proper hand hygiene in conjunction with disinfection and decontamination is vital for preventing fecal-oral transmission. In settings where aerosolization is of greater concern, masks, gloves, and even ultraviolet light can be used to decrease norovirus risk. These measures can also be employed to halt the spread of norovirus during an outbreak. Isolation is a common strategy employed to prevent secondary transmission of norovirus in the hospital setting. Closure of wards and units has been shown to reduce the number of cases and the duration of outbreaks. It is also important to track down the source of an outbreak. Epidemiologists conduct interviews, coordinate specimen collection, and review diagnostic data in order to identify the source. In the case of norovirus, food preparation is frequently implicated. Should it be determined that contamination occurred before the point of sale, a recall may be issued. If an outbreak is traced to an individual, not much can be done other than to warn potential victims and prevent further spread using the techniques mentioned earlier.